will you require all federal employees to get vaccinated?
That's under consideration right now, but if you're not vaccinated, you're not nearly as smart as I thought you were.
President Biden there saying this afternoon that vaccines could become mandatory for all federal employees, for the federal government workforce, which would mark a major expansion in the effort to ramp up and require vaccinations. It follows new CDC guidance that came out today that says that fully vaccinated people in areas with high COVID transmission rates should wear masks again indoors, citing new data about the Delta variant that suggests vaccinated people could actually carry higher levels of the virus than previously understood and could be able to infect others. The White House is already following that guidance. NBC News has just learned that all staff, regardless of vaccination, must wear masks indoors starting today. An official telling NBC News that Vice President Harris wore a mask inside today because, quote, this afternoon, Washington, D.C. was classified as having a substantial level of community transmission. Let's bring into our conversation Dr. Naheed Bhadelia, infectious diseases physician, director of Boston University Center for Emerging Infectious Diseases and Policy and Research, and an MSNBC medical contributor. And David Leonhardt is here, senior writer for the New York Times. David, I will tell you, when I get scared about the COVID headlines, I go searching for your Twitter feed and read everything you've written. And you've had, for people who are not doctors and not scientists and don't even try to play them on television, you've had some reality checks about the Delta variant, especially about kids. Can you talk about that, about risk to kids, and about, while the Delta variant is more contagious, it's not clear yet whether it's more deadly?
Thank you, Nicole. First of all, I really appreciate that. And that's right. Look, we're still gathering all kinds of evidence about the Delta variant. And so I think it's important to say at the outset that some of these things may change. But we have to go on what we have right now. And what we have right now is that, consistent with every form of COVID, including the other variants, the chances that a child gets a severe version of this, a version that might end up with hospitalization or horribly with death, or even a version that would end up with bad symptoms for weeks or months on end, those odds are extremely, extremely small. They're not zero. And so I think many people say, well, these are my kids. I don't want to expose them to any risk. But what I've tried to point out is you do expose your kids to risk every day. You put them in automobiles. You let them go swimming. You let them eat food that requires chewing. And from what we can tell, things like swimming and riding in automobiles presents a greater risk to a child's health than COVID does. And so as we balance things like whether kids should go to school, whether they should be socializing with friends, I think it's important to keep that in mind.
And Dr. Bhadelia, I bring that up because I think it's really important that this part of the coverage is really specific and really focused. And the risk to all of us is unvaccinated Americans, both to themselves and to our way of life and to our economy. And my question is, why doesn't everybody mandate vaccinations as a term of employment, as the Washington Post today announced that they would do?
Nicole, I think it would make a difference because, when CDC released their guidelines, the big concern is, and you may actually have me on video saying that, the big concern that I had was both the unvaccinated and the vaccinated are going to unmask. And the guidance was not linked to the number of cases in the community, right? And I think now, if you see this mask mandates go up, maybe it's going to make both the unvaccinated and the vaccinated get masks, and that's going to have a benefit. But that's just a stopover until we can get people vaccinated. 100 years ago in 1918 influenza, you had the successive waves, and we were so vulnerable, and we had these non-pharmaceutical interventions that we still have, but we have one extra tool, and it is the vaccinations. And the numbers right now are saying that of the people where half of the country is vaccinated, of the people who are not vaccinated, 45% say they will definitely not get vaccinated. And so we need to make accessibility improve, but we need to make sure that we also have the stick, which is the mandates with work. We've done that with other vaccinations in schools. We've done that in healthcare settings with other vaccines. And I think this is a smart move because that is what's going to get us to the other side of it while we try to get the numbers down with these non-pharmaceutical interventions.
David, what is your sense in sort of covering internal debates inside the government or inside companies about why we aren't being more aggressive with vaccine mandates? I mean, to go to kindergarten, I had to produce a vaccination record for my child. Working in government, you subject or you submit to polygraphs, you submit to drug-free workplaces all the time. Why not a COVID vaccine requirement for all sort of mainstream, acceptable companies that want to remain commercial?
I'd sort of separate this into two categories. I don't think the federal government can very easily mandate this for anyone but federal employees. When you think about American political traditions, I don't think if Joe Biden tried to mandate this for all Americans, it would work. I think it would get tied up in court. So I think we're really talking about businesses, local governments, schools. I do think those will work. I mean, they've worked historically, as we're talking about, and we mandate all kinds of things. I think a lot of this is a fear of businesses and local governments not wanting to get dragged into these huge, messy fights in which the minority, but it's a loud minority of people who don't want to be vaccinated and don't want to be told what to do, raise a big stink and file lawsuits, and then the businesses and the governments have to deal with that. I do think that's why momentum is really important here. If some businesses start to do it, and then you're not the business that gets mentioned on MSNBC when you announce a new mandate, you're just one of a dozen businesses that day that does it, I think you're going to see more businesses willing to do it in that way, and it'll save lives. And it won't just save lives. For those of us who've already been vaccinated, it'll make it possible for us to get back to daily life, which is really important.
I mean, Dr. Bedelia, let me just press on this. I mean, I think it's great that the Washington Post has a proof of vaccination as a requirement for working there. And I'd certainly feel a lot better about going back to work in September if I worked at a place that had that requirement. I mean, is it the medical advice to any company? I mean, if any company called you and asked your advice, would it be your medical advice that the best way to eradicate COVID is to mandate vaccines?
It's certainly the best way to keep an outbreak from happening as you bring workers back, right? The reason our economy is stagnant is because people are not able to get back to work at the same indoor capacity. And there's news about Delta, which I want to interject a little bit more of this, because what Delta variant has done is change the equation a little bit. What Dr. Walensky said today, right? The idea that people who are vaccinated, yes, they have much lower rates of infection, but when there is infection, they may still have virus and they could, in some cases, be able to transmit it. Changes the equation, which means if you bring those workers back, unless you're requiring everybody to wear masks, which some places may do that, particularly when there's high transmission, the vaccinations are a way to get out of there. The only other way that some businesses have gotten around it is if you're not going to vaccinate everybody, some people are asking for exemptions, is to make them go through additional testing and to wear those masks. And that's what keeps the workplace safe. And that's the advice that I would give to businesses who ask for my advice.